Hello, my name is Alina, and I'm a student at the University of New England. Today I'm going to talk about the connection between magnesium and heart disease. So, what is magnesium? Magnesium is an essential mineral in our body. It is the fourth abundant mineral in the body, found in the bones. About 50–60% of magnesium is in the bones. It's also in muscles, and only 1% is in the blood. It is absorbed mostly in the intestines and excreted through urination. Magnesium is involved in more than 300 reactions of the body. Some of them are maintenance of normal heartbeat, keep blood pressure normal, and muscle and nerve function. And these functions are critical to the cardiovascular system. It also regulates calcium, potassium, sodium, and it's essential for cellular health. So hypomagnesemia is low magnesium. The causes are decreased intake of food. So usually magnesium comes from fresh foods like spinach, bananas, also lentils. So if someone is eating more processed food with hardly any nutrients and less fresh food, so there is a decrease in magnesium intake. There's also a decrease in absorption due to medications and also being elderly. So some medications impair absorption. And there's also a sign of low magnesium in the soil. So the role of magnesium in cardiac. Magnesium is required for proper electrical signaling with the heart muscle and helps stabilize a normal rhythm. Deficiency in magnesium has been shown to increase arterial stiffness and increasing blood pressure and workload on the muscles. So low magnesium impacts cardiovascular health and mortality. Studies have been shown that increased intake of magnesium can reduce cardio mortality by 50%. So some of the signs and symptoms of low magnesium is loss of appetite, fatigue, poor memory, confusion, nausea, and vomiting. So low levels can also cause weakness and sudden death. So what do the studies say about the role of magnesium in the heart? Andrea Rosnoff, who's the director of research in the Center for Magnesium Education in Hawaii, studies the magnesium connection to heart disease, and her findings were that CVD is linked to low magnesium levels. Dr. Rosnoff says that many doctors usually do not check magnesium levels in heart disease patients, and after conducting many studies about magnesium and heart disease with her patients, she came to a conclusion that giving these patients the right amount of magnesium can help correct or prevent cardiovascular disease. In a systematic review for 4 studies, including more than 27,000 cardiovascular patients, testing for low magnesium levels and CVD, hyperglycemia was associated with increased risk of CVD and death in elderly patients. The conclusion in the current evidence supports that importance of dietary magnesium for lowering CVD risk and possible death. A different study based on genetic provided evidence that magnesium levels are associated with the risk of cardiac disease. A different study checked the influence of circulating dietary magnesium for the risk of CVD. The results were that circulating magnesium was associated with 30% lower risk of CVD. The conclusion was that dietary magnesium is associated with CVD risk and prevention of heart failure, with supportive clinical trials to evaluate how much magnesium is needed for prevention of CVD and heart failure. The recommendation were that to increase magnesium-rich foods and supplements. So the conclusion of the studies, many studies were conducted in the US, Britain, Spain, and other regions of the world with thousands of heart disease patients, showed there is a strong connection between low magnesium levels and heart disease. All these studies and trials showed when giving supplements to CVD patients, it improves their health and can prevent death due to cardio disease and heart failure. Methods of the study is 100 cardiovascular patients ages 50 to 75 in Cedars-Sinai Medical Center. Men and women will participate in the screening for magnesium level study. Half of the patients have CAD, which is coronary artery disease, and half have a history of heart failure. So CAD is coronary artery disease. It's the most common form of cardiovascular disease, which is hardening or narrowing of the arteries, and half will have a history of heart failure, which occurs when stiffness of the heart prevents the organ from pumping blood through the body. The reason now the participant will get their magnesium level checked and will be giving magnesium supplements to take daily for a whole year. So for women it is recommended to take 320 milligram, and men will take 420 milligram a day. All participants will be required to fill up a questionnaire about their health, medications, what kind of food they're eating, employment, level of exercise, and how is their level of energy. The participants will have a blood test plus special magnesium screening to check their magnesium level before the start of the study and after 1 year when the study is over. According to the Center of Disease Control and Prevention (CDC) report, heart disease is still the #1 cause of death in the United States. In the year 2019, there were almost 1 million deaths from CVD. more than all kinds of cancer combined, which is the second cause of death. Many studies were conducted in different countries showed a strong connection between heart disease and low magnesium levels. Many tests are being conducted for CVD, but magnesium levels in an RBC test usually are not checked. Based on current literature, reviewed and anticipated findings, the accepted results are going to be that daily magnesium supplements will have a positive effect on the health of CVD patients. It can improve their health and prevent premature death due to cardiovascular disease and heart failure. The patient's lipid panel will improve. There will be less hardening and blockage of the arteries. The patients will have more energy, and some of the medications might be reduced due to their improved physical health. Magnesium is a mineral needed in the body in small amounts, but it has many important functions in the body. Magnesium is the gatekeeper for calcium being allowed into muscle cells and cause contraction. The magnesium ushers the calcium out of the cell. Without magnesium, calcium floods the cells and leads to hypercontraction of the muscle cells, which can cause a heart attack. Many CVD patients have low magnesium levels due to medications, hospitalizations, and being elderly. Magnesium supplements and increased food intake with high magnesium levels will improve health and reduce death rates in CVD patients. And that concludes my presentation. Thank you for watching.